Sometimes it's possible to get all the right information, have even some of the right logic, and still get the wrong answer. Despite the fact that Ontario is still well in the grip of the second wave of the pandemic, the government has decided to begin phased reopening of the economy next week. So that's a terrible idea. See, the thing about pandemics is that they grow exponentially, and I've talked before about this. If you have one case, then you have 5 cases. If you have 5 cases, then you have 25 cases. That's just the way it works. The only way to effectively control a pandemic is to completely eliminate it. It's the same thing as with, fruit flies or something like that. If you have an infestation of fruit flies in your kitchen, you don't take out all the garbage and leave a single banana peel on your kitchen counter, because the banana peel will very quickly have more fruit flies. No matter how many times you take out most of the garbage, unless you take out all of the garbage, there will be more fruit flies. And yes, it will be a phased reopening, which means the areas with the lowest infection rates will be reopened first, but that doesn't mean that those areas have no infections. That means that they have less of a risk of reinfection. So that means that, yes, there will still be a banana peel on the kitchen counter with fruit flies in it, but we're going to reopen anyway because, well, the economy. And of course they know this. All the public health officials are saying, don't do this. Just don't do it. It's the worst idea. But yet, economic needs trump all health policy. At this point, the rate of infection is still twice as high as it was during the peak of the first wave of the pandemic. It does not make sense to end the lockdown measures or even relax the lockdown measures until the rate of infection drops to nearly 0. I can't help but think that this decision is being motivated by the logic of, you can't make the cure worse than the disease, which frankly is bullshit, because the disease is a deadly pandemic that has potentially lasting, potentially permanent effects on even people that do survive it. It is among the most infectious, the most virulent pandemics that we have had in many generations, and yet we're allowing it to continue. There's an equation being struck between economic activity, economic growth, and people's fucking lives. And yes, there are costs other than economic ones that are involved in a lockdown process. It's rather distressing. My video yesterday described exactly how distressed I am at this lockdown, as are many other people. And yes, there are some mental health issues that simply cannot be addressed during a lockdown. Of course, there is some other aspects as well. People are trapped in maybe abusive relationships. They're trapped in homes that are dysfunctional. They're maybe not getting the resources. They're not getting the tools necessary to even live a healthy life if they're not able to, say, get to school for school lunches, things like that. But there are other ways of solving that problem that don't necessarily involve people dying. We seem to keep forgetting that it's a matter of life and death we're dealing with here. The equation is not merely one of inconvenience versus economic growth. It's a matter of people will die if the wrong decisions are being made here. And a not insignificant number of people have been saying things like, more people are dying of the flu, or more people are dying of drug overdoses, or more people are dying of pandemic restriction-related things than COVID itself. Well, there's a reason for that. Because the restrictions, the lockdown, is preventing people from dying of COVID. If you want to see a very clear demonstration of this, look at the situation south of the border. Look at the United States. Their death rate, their number of deaths has now almost surpassed 500,000 people. This is the control group. We're looking at what happens when nothing is done to combat the spread of an infection. Yes, some states have done some things. Yes, some municipalities have done some things. But nothing until this point has been done on a federal level. And yes, thankfully now under the Biden administration, something will be done. Hopefully enough to be able to control the spread of the pandemic so that it'll stop washing over the border into Canada. But If we did the same thing as they did, i.e. nothing, and if we stop doing as much as we do, we're going to end up with more people dying. So yes, it is an accurate fact that the effects of the lockdown are more deadly than the pandemic has been. That is a true fact. However, if there were no lockdown, not only would you have the effects of the lockdown in part, but you would also have lots and lots of people dying of the pandemic. Do we want that? I don't want that. Let's not do that. So seriously, Doug, let's not do this. Let's deal with the pandemic first. Completely deal with the pandemic. Take out all the garbage. Get rid of all the banana peels. Make sure the fruit flies are completely gone. And then we can buy bananas again. Anyway, I do these videos daily and I'm clearly very angry today. So if you enjoy my content, hit the like button, subscribe to the channel, all those algorithmic things, and I'll see you tomorrow.